The Dix-HallPike testing is the gold standard when looking to diagnose posterior canal benign paroxysmal positional vertigo. With our battery, we use a modified version of the Dix-HallPike by having the patient turn and then lie on their side. This is better for the patient because we are not provoking any kind of cervical issues. We're not hanging their heads off the tables, which can sometimes result in cerebral hypoxia. And this is also comfortable for patients that have any kind of low back pain. The test is performed by having the patient sit upright and then rotate their head 45 degrees to either shoulder. The technician will then lie the patient on their side and look for any nystagmus. While the patient is in the provoking position, the technician will also question the patient to see if there's any report of vertigo. We are looking for transient or persistent vertigo when in this position to help us determine if it's a peripheral or a central lesion. We also use the Dix-HallPike test to evaluate for possible orthostatic hypotension when sitting the patient up. When that occurs, many patients will report lightheadedness when they are sitting up from the supine position. When performing the Dix-HallPike test, a positive test tells us that there is benign paroxysmal positional vertigo in the posterior canal on the ear that we are testing. Following the Dix-HallPike, we perform head positional testing. The patient is enclosed in darkness again, and we have them turn their head in specific positions. This gives us very useful information regarding central or peripheral or even cervical issues that could be causing the patient's symptoms. We can see any type of nystagmus that may be elicited with this test, as well as any report of symptoms from the patient similar to the Dix-HallPike testing. This is performed by having the patient lie flat on the exam table and turn their head 90 degrees either to the left or the right. Patients that cannot adequately turn their head or do not have the cervical range of motion, we can use body positional testing to accomplish the exact same goal.